Hello, viewers. I'm Mr. Dilip Kumar Pal. Stand before you with a video Types of Disability Part 2. In Types of Disability Part 1, I have discussed physical disability, which is three categories like mobility disability, visual disability, hearing loss. And I have discussed second type of disability, sensory disability, autism spectrum disorder, blindness and low vision, deafness and loss of hearing. Up to this, I have discussed in the first video, types of disability part 1. In types of disability part 2, I will discuss sensory disabilities, four categories, sensory processing disorder. From this, I will start the types of disability part 2. But before I discuss types of disability part 2, from sensory processing disorder onwards, I want to inform my viewers that name of my channel is at the rate Dilip Kumar Pal 9375, where you will find videos from plus 3 first semester to 6th semester political honors, videos of plus 3 first semester to 5th semester ethics and values, videos of plus 3 first semester to 2nd semester political and general elective, videos of environmental studies of plus 3 first semester, and some political science videos of plus 2 first year, plus 2 second year. Any video you want, just write my name Dilip Kumar Pal and the name of the topic in Google or YouTube. You'll get bilingual videos both in Odia and English. E-videos are available in the channel. Let us start. Sensory processing disorder, SPD. What it means? It is another type of sensory disability. So what is sensory processing disorder, SPD? This type of disability is known as sensory integration function. Sensory processing disorder is otherwise known as the sensory integration function. Sensory processing disorder is a condition in which the brain has trouble in receiving and responding to information that comes from the senses. So, sensory processing disorder means the brain will have trouble in receiving information from the senses of the human body. What are the symptoms? Unable to tolerate bright light and loud noise. By sensory processing disorder, there will be a symptom unable to tolerate bright light and loud noise. A person will have problem to tolerate bright light and loud noises. Number 2, sometimes refuse to wear clothing because it feels scratchy, means uncomfortable or rough. Sometimes a person suffering from sensory processing disorder, he will feel uncomfortable to wear clothes because he feels that clothes are rough. 3, be distracted by background noises, means the brain has to work harder to focus on what you want to concentrate on. Whenever a person will suffer from the sensory processing disorder, he will have problem if there will be background noises. In that case, the brain will have to face hard to concentrate on the object. The brain will have to give more attention to give concentration to the object. 4th, having trouble in understanding familiar relations. Number 5, fearful surprise touches. Avoid hug. Cuddling means to hold in arms. It means if there will be any touch to his body, he will be surprised. He will avoid if there will be hold in arms. If somebody will hold him by arms, he will be fearful. It means If there will be touch, a person will be surprised. This is known as the sensory processing disorder. Then the third one is somatosensory impairment. What is somatosensory impairment? It means one's ability to effectively process sensory information received by the skin's sensory receptors is affected. It means there will be problem in sense receptor in the skin. The sense receptors in the skin will be unable to give information. In other words, it affects individual's ability to feel pain, light, touch, and determine the temperature. By this problem, a person will be unable to feel pain, touch, light, and temperature. It can be due to many health conditions. It can be due to many health conditions like stroke, heart stroke. Then cerebral palsy means abnormal development of that part of brain that controls the movement, and brain injury. So if there will be some diseases like heart stroke or cerebral palsy means abnormal development of that part of brain which controls the body movement, brain injury. By this there will be problem of somatosensory impairment. Then some somatosensation is 5 types. There are various types of sense system in the skin. These are 5 types. Number 1, mechanoreceptors. There are 5 types of senses in the skin. One is mechanoreceptors. What is the function of mechanoreceptor? These are teeny sensors that detect touch, pressure, stretch in the skin and other tissues. There are some sense receptors in the skin, those who receive, those who detect touch, pressure, stretch in the skin. It is the function of mechanoreceptor. Number 2, thermoreceptors. It is also in the skin. It is a sensory nerve cell that detects changes in temperature. There are some senses in the skin which detect the temperature. It is known as the thermoreceptors. Number 3, proprioceptors. These are receptors to give knowledge about the body's movement. In the skin, there are some receptors known as proprioceptors, those who give knowledge about the body's movement. By knowing this, a person can think about next step. They will give information about the body movement. By this, a person can think about the next step. Fourth one is pain receptors or nociceptors. It is a sensory neurons that respond pain from the body and intimate the pain to brain, and brain create the sensation of pain to direct attention to the body part so the threat can be mitigated. Then pain receptor or nociceptors, it is their duty to feel pain. If there will be pain in the body, they will detect and inform the brain, and brain will give directions to different body part so that the threat can be, the problem will be solved or threat can be mitigated. Then the fifth one is chemoreceptors. It is a nerve cell that detects changes in the chemical composition of body. It is a nerve cell that detects chemical composition in the blood. So these are the, it is all about the somatosensory impairment. Now discuss balance disorder. It is another type of disability. It is a kind of disability of human body. Balance disorder is another kind of disability of the human body. In this condition, one will not have control over the body. In this system, one will not have control over the body. If you are standing, sitting, lying down, you might feel as if you are moving, spinning or floating. If in this system there will be no control over the body. If you are standing, sitting or lying down, you might feel as if you are moving. Even if you are sitting, you feel as if you are moving or floating. In this problem, if you are walking, then you might suddenly feel as if you are at the end point or extreme point. If in this problem, if you are walking, you will feel as if you are in the end point or extreme point, or like the peak of the mountain where tipped and with snow. If you are walking, you will feel as if you are in the edge of a mountain peak or ending point of the mountain peak. Following are symptoms of this balance disorder. Following are symptoms. Number one, feeling of falling as if you are going to fall. Feeling of falling as if you are going to fall. Number two, nausea or vomiting. Number three, blood pressure. Number four, changes in heart rate. Number five, fear, anxiety, depression, and panic. Six, confusion or disorientation. There will be confusion. Seven, blurred vision. Vision will not be clear. Then lightheadedness or feeling of faint. Lightheadedness or feeling of faint. A person will feel as if he will become unconscious, faint. Then vertigo or feeling of people as if they are moving. Vertigo means feeling of people as if they are moving. Following are the causes of balance disorder. What are the causes of balance disorder? Number one, ear infection, continuous medication, if there will be continuous taking medicines, head injury, low blood pressure, eye muscles imbalance. These are the causes. Now discuss intellectual disability. It refers to a type of disability when there are limits to a person's mobility to learn at an expected level. Intellectual disability means whenever a person will be unable to learn at the expected level. In this problem, a child is not able to capture or understand learning process. A child will be in problem to understand different things. A child will have a problem to learn. Following are the causes. What are the causes of intellectual disability? Number one, problem in the brain, birth defects, genetic condition, problem from the parents, serious head injury, stroke, heart stroke. Infections happen before birth. Before birth, there will be infection. Fetal alcohol syndrome or taking alcohol during pregnancy. Down syndrome means presence of chromosome 21, which delays child's mental development. If there will be presence of chromosome number 21, there will be problem in child's mental development. Following are the symptoms. What are symptoms of intellectual disability? Sit up, crawl, walk later than other children. Sit up, crawl, and walk later than other children. Find it hard to remember things. It will be difficult to remember things. Number three, have trouble in understanding. There will be trouble in understanding. Four, have trouble in solving problem. Have trouble in solving problem. Fifth, trouble in speaking. There will be trouble in speaking. Have trouble in understanding logical concepts. There will be trouble in understanding logical concepts. In types of disability, part 3, I will discuss some other types of disability. So I request my viewers to subscribe my channel so new videos will come to you. And there are many students who are ignorant about this channel, which has many valuable videos. I request my viewers to aware of your friends so some students will be benefited. Remember, a little help to anybody will not go in vain. It is a symptom of a human being because a true human being always try to help. Thank you. Have a good day.